addition to that, I've actually bought the practice 11 years ago, so I've been in practice. I need to update my bio is what it comes down to, and being I Connect. So, but I've been in practice for 11 years. One of the first things I did was actually join this chapter when I started my business. So I was right behind Scott as far as one of the original members anyway. So, but thank you guys. I'm Caleb White. I want to give you guys a little bit of background about where I'm from. And a lot of that has to do with who I am as a person, but also how I run my practice and my philosophy behind what I do with my patients. So I grew up in a small town in southwest Kansas. Mineola was the name of the town. Does anybody know where Mineola is? Kansas. Kansas. It's Kansas. There you go. It's in Kansas. A big open space that you take I-72 and go forever to get through. So, but it's a very southwest corner, south of Dodge City. So if you guys watch Gunsmoke or any of those good old westerns, that's kind of where I'm from. So I grew up on a farm. We had about 2,500 acres that we farmed when I was a kid. Dad still farms about 1,500. He's let some of the land go as far as that goes because it's just him now, not my brother and sister and myself that are back helping him. But we had a cow-calf operation. We still have cattle. That's where I get my grass-fed beef that I feed my kids, and I'm very adamant about when people talk about meat. I go, there is good meat out there that you can have. It just needs to come from a quality source. But that's where I grew up. And so went to high school in Mineola. Was very fortunate to be able to play college football at Pittsburgh State University, which is a Division II school in southeast Kansas. So on the other side, crazily enough, that's about an 8-hour drive across Kansas to get from one end to the other. But yeah, that's right. Yeah, very slow sometimes. But that's where I went to school, played football there. And actually, I'll come back around to that because that's one of the reasons why I decided to choose chiropractic as a profession. But I went to school there. I actually took a year off. I applied to med school, chiropractic school, and DO school. Got accepted to all three. I was hoping that was going to make my choice for me, and it did not. So then I had to make a decision. But during that time, I decided to take a year off and decided to come to Colorado on the west slope to a small town called Hotchkiss, Colorado. Does anybody know where that is? Okay, good. Yeah, western slope. So over by Montrose in that area. But decided to go over and be a permanent substitute for a guy that got called over to Iraq. So I knew some people in that area and decided to go over and just do it for a year while I was deciding what I was going to do beyond. So I went over there, very fortuitous as far as when I was over there. I met my wife, that's now my wife. So there was a reason that I went over there for a year, but I coached and taught there for that amount of time. Finally, I decided to go to chiropractic school. I decided to kind of do that, and I'll talk a little bit about why here in a second. So I convinced her to come back with me to Kansas City and went to Cleveland Chiropractic College. So I have two of the probably colleges I went to are the two most confusing colleges in the world as far as names. So Pittsburgh is in Kansas. And how they differentiate themselves is very interesting. They don't put an H at the end of the Pittsburgh, so that's how they say, oh yeah, we're different than Pittsburgh, Pennsylvania. Anyway, so but it's got a very rich history of mob and that kind of stuff. If you guys are ever interested in talking about that, it's kind of very interesting. So and then Cleveland Chiropractic College, which is in Kansas City. So again, just two random places that I went to school that just are very confusing as far as location. But I went there, graduated there in August of '07, came out here, very fortunate enough at that point to still get a small business loan. That was right before the crash, right before. If I'd have done it 6 months after, I probably would not got the same loan that I did as far as to buy the practice that I bought. But I bought an existing practice. So a lot of chiropractic students, when they graduate, they go out and are associates or interns. I decided to go straight from the VA hospital, which is where I worked at in Kansas City, straight out here after I finished my internship with the VA hospital, straight out here to buy a practice. And so started that in '07, been kind of doing it ever since. But I wanted to kind of talk a little bit about what is chiropractic and why is it that I chose chiropractic. And the biggest reason was I had an injury when I was playing football in college. I had a spiral fracture in my ankle. And so fracture that wasn't clean, it actually kind of spiraled up my ankle, and so they had to go in and actually put a metal plate in there and screws and allow it to heal. That happened my sophomore year, and so I was in a rush. I'd had a really good season. I got to play a lot. I got a few accolades as far as my sophomore year, so I was wanting to get back to play as quick as I could. Well, I just was not able to do that. As quickly as I wanted to, I wasn't able to get back to cutting, and so one of the biggest things that I did was went back to my hometown for the summer to help my dad on the farm. But I also went back to try a chiropractor that was also a college football athlete, my mentor, but to try him out as far as to see if he could help me kind of along with that process. So everybody's always kind of confused as far as, actually it was a work with my ankle that actually got me into chiropractic rather than work with my spine, which is what chiropractic is. It's not necessarily specifically just with your spine. If it's a joint, it can get restricted, it can stop moving, and that is what I work with. And so shoulders, elbows, wrists, knees, ankles, your spine, your neck, your occiput, all these things can get restricted and can cause pain, tenderness, and actually effects on your neurological system as far as pinching nerves. So that's what happened. I went back to this chiropractor in my hometown, and he actually adjusted my ankle. Was the loudest pop I'd ever heard in my life. I thought, is that right? Did something happen there that wasn't right? But within a few days, I was actually out cutting. My range of motion was better. My body wasn't in protect mode as much because neurologically, those nerves had finally got to the point where there wasn't pressure on them, and they were actually being stimulated. So there's little nerves in your body called proprioceptives and mechanoreceptors. And both of those nerve receptors actually stimulate healing in the body, but they also decrease pain pretty quick. So if we can kind of stimulate those nerve endings, which again with adjustments and specific adjustments, we can actually do that. It actually allows the body to heal and get range of motion back pretty quick. But that's what chiropractic is, and that's why I got into chiropractic. And so I wanted to spend a little time, I think I got a little bit of time, talking about the two biggest questions that I have about chiropractic. Is it painful? And then, do I have to go forever? And depending upon who you talk to in chiropractic, those two questions can be very, very, very varied. And so our philosophy is with chiropractic and Northeast Chiropractic Center, with all three of the practitioners that we have, is that your body is designed to heal itself, but it's also designed to stabilize. We just got to give it the tools that it needs to allow for that stabilization process to happen. Most of the time, that's me telling you to go do stuff at home that actually is something that with muscle work, with stretching, with mobility, that you guys can do so you don't have to come back and see me as often. It's not something where I want you to come back and see me 3 times a week for your whole life. Like at some places in town, that's their philosophy, that you go in, you buy a big plan, and that's just not our philosophy. Our philosophy is every patient is different. So somebody that comes in pain, I might see them a couple times a week for a few weeks, but as I see objective changes in their body, I'm giving them tools to do at home to where they don't have to come back and see me as often. So my philosophy is I'm trying to get your body to do the job that it's supposed to, and it's just my job to train it in the right way. And so a lot of that has to do with the adjustments that we do on a day-to-day basis. We work with great massage therapists like Dawn and awesome PTs like Scott and Turning Point, and that allows us to do our job well, so then we can work on that stabilization process with outside stuff. So that's our philosophy with having to come back. I have patients that come in once a month because I don't know if they just like to see my pretty face or something. I don't know. I don't think that's it, but that might be it. No, I'm just joking. But it is something, Scott. That's why you do it. Okay. But it is something that a lot of times preventative care. We talk about preventative care with a lot of different health realms, but preventative care is definitely a good thing. So I have patients that choose to decide to do that. They come in once a month and just make sure that things are correct and in good position. From my athletes that I treat, that's definitely what we want to do, is to keep their performance high. So then I'm for sure treating them, especially during season as far as that goes, to keep that balance and coordination the best possible way it can. So I do see people that way. Last question before I run out of time, does it hurt? And it's a very varied question. It does not hurt If you're already in pain, sometimes it takes me some force to get into that position, but usually it's a relief of pressure, and that's what the popping sound is, a relief of pressure. So it feels good. Thanks, Dave, for the comment. Yes, so if you have any questions, definitely talk to me later, but that's what chiropractic is to me. Thank you.